Thanks for joining us. I'm Judy Simpson. Today we continue our occasional series of programs on your health and cancer. In partnership with the University of Vermont Cancer Center, we're able to draw on a wide range of cancer experts who can provide reliable and up-to-date information to you and your family. This afternoon we're going to focus on a cancer that affects only men. It's prostate cancer. Joining me is Dr. Scott Parapato. Dr. Parapato is a Cancer Center member and a urology specialist with the UVM's Medical Center. Welcome. Thanks so much for coming in.
Thank you. Glad to be here.
Before we talk about prostate cancer, let's talk about the prostate. What is it? Where is it? What does it do?
Yeah, that is the most pertinent question.
Yeah.
Well, the prostate is a gland that has one function, and it's to produce fluid to make the sperm happy for reproduction. So that's its job. The problem with prostate is two. One is once a man even gets into his 30s, it keeps growing, which can cause urination issues in men as we get older. And the other thing is, as we get older, the prostate gland can go bad and form cancer.
So maybe we can take a look at a slide so we can talk about the region that we're talking about.
Right. And so as you can see on the screen, the prostate is a gland. It's about the size of a walnut when a man is young and a tangerine when we're older, and it lives right at the base of the bladder. And again, it's a gland that produces amazing amounts of fluid that goes in, mixes up with the sperm, that then comes out through the urethra to do its job.
And so why does it grow?
Well, that's a great question. It actually is a benign tumor, and actually a lot of scientists use it as a model for tumors to work on prevention. But the good thing is it's never ever malignant, but just its enlargement. So maybe we weren't meant to make it past 40 years old, but it just keeps trying to grow.
And so what is prostate cancer?
Sure. So cancer is when some of the glands go bad, like any cancer, and then they can grow out of control and cause local problems around the bladder and urination. But the biggest fear is, unfortunately, like breast cancer and other cancers, it can spread. So the different stages that you see on the diagram, all cancer starts locally, and any cancer found locally can theoretically be cured, and there's a lot milder treatments now. But once it grows past a certain point, it gets the ability to spread, and it goes to bone, unfortunately, and then they can be controlled for many years but cannot be cured.
Is it a slow growing cancer?
That's a great question, because traditionally we thought all prostate cancers were slow. What we found is that, yes, 60–70% are very mild cancers, if you can say that, and you can control them for a man's life without a lot. The trouble is about 30% for sure can actually influence a man's life, and within a few years.
So how common is prostate cancer, and who is most at risk?
Yeah. Prostate cancer is unfortunately incredibly common. A lot of people don't realize we wish breast cancer on no one, or prostate cancer, but prostate cancer is the same incidence as breast cancer. So it's very common. It's the most common male cancer, like breast cancer is the most common lady. And 1 in 15 men are going to deal with prostate cancer in their lives. But again, the difference is some are mild and just have to be identified that they're not bad ones, and men go on just fine.
So age is a significant risk factor. In Vermont, 60% of prostate cancer cases are diagnosed in men over 65. Do we know why age is such an important factor?
Yeah. Age with cancer in general, unfortunately, as we all get older, our body has great defense mechanisms against cancer, and our immunological system is fighting cancer and making cells better all the time. And some of that breaks down as we get older. But the most important thing, as you alluded to, is family. There's certain risk factors that men have at age 30. A family history, a genetic change is very common. What we know now for prostate cancer is if my first-degree relative, my dad, my brother has prostate cancer, my risk is more. And some new genetic changes, BRCA gene, the same breast cancer gene that ladies have that predispose them to breast and ovarian cancer, a man can have that gene. And then he has a 75% chance of getting prostate cancer at a young age.
Do you recommend that people get tested?
Yeah, that's starting to straighten out. Traditionally, we did random screenings. They weren't very accurate. There's been huge changes since the Preventive Task Force said you got to do better. And now the guidelines are firming up. So yes, a man between 50 and 75 who's in good health should absolutely talk to their doctor, simple blood tests and checkup. And then that will be followed, very conscientiously. And there's now clarifying blood tests. So if I have a funny prostate-specific antigen blood test, which is a simple blood test of protein for prostate cancer to clarify it. So many men don't need biopsies or other invasive diagnostics like they used to. But if they warrant it, then it's available to them. And
so you recommend a basic screening, and then what happens?
Yeah, so a man between 50 and 75 would talk to his family doc and say, hey, should I do this? And they would talk about getting a blood test and a checkup. And then if it was abnormal, it would be repeated. And then if it continued to be abnormal where there's a chance of cancer, there's some new blood tests, one of which is called Prostate Health Index, a new type of PSA. And again, that clarifies 60% of the men right there. The rest we can't know, and they have to have an office procedure called a biopsy or a sampling of the prostate to know if there's cancer or not. So that's important. The other thing is knowing a man's risk is so critical for this. A man at 40 should know if his family has a risk, or nowadays, thanks to the media, people know about BRCA gene, breast cancer gene, and many men are coming to us. So in those special cases, those men, even at age 40, should have a prostate cancer blood test because if it's really good, they don't have to think about it again until they're 50. Right. If it's abnormal, then they could prevent a problem. What about
the psychological toll that it takes when a man is diagnosed with prostate cancer?
Yeah, that's the biggest thing on both ends. You have a 40-year-old healthy man, young family, and saying you have to get checked for a cancer that's a high risk. So that's very hard. There's great psychological supports, through the community and the family doc. And the second thing is if you have cancer, it's hard to imagine, but 60% of men with prostate cancer, there are mild treatments or even just close checkups or active surveillance that they'll do great for their whole life. But psychologically, it's tough.
Yeah. What are some of the symptoms? Are there symptoms that
No, that's the problem. It's just like breast cancer and other cancers. There are no symptoms at the earliest stage. And when a man does have difficulty, so you look for things that might be a thing, such as the symptoms listed on the screen. If you do have weird urination issues that are just, wow, this is different than yesterday, blood in the urine or the semen. So those are the signs to look at. Even if it's rare, you have to look for them. But the biggest thing is to be proactive and before you get those symptoms to kind of let your doctor know, hey, I'm at risk and what should I do to prevent it?
You want to be on the radar.
That's right.
And so what do you recommend for people to do, people who are watching this, maybe a woman who's, I mean, my husband will have the conversation with me tonight and he'll say, who did you interview on Across the Fence? Why are you asking me these questions?
Yeah, well, basically, again, you mentioned it's hard, first take the fear out of it.
Right.
You know that, odds are it's not going to be a problem and that. So men between 50 and 75, whether you're in Europe, Asia, the United States, the recommendations are to consider a blood test and a checkup every year and know your risk. That's the big one. Know what your risk, and then at age 40, talk to your doctor about what simple tests you can get to keep out of trouble.
Are there any myths about prostate cancer?
Oh, many, many. Prostate cancer has no effect on sexuality. It doesn't have effect on aging. It doesn't cause both ways. But the other myths, which are a little bit harder to dispel, is that everyone's going to have prostate cancer and all prostate cancers are not an issue. And I'm a prime candidate. I have some family history of certain cancers, and I'd like to forget it. So I'd like to the myth is, well, that's not going to get me. So unfortunately, some things, if we follow a good diet and stay healthy, the cancer checkups are important.
Yeah, it's really our responsibility.
Right, and especially in this day and age, the person has to be their best advocate.
Now, when it comes to prevention, we're told that nutrition and exercise are important. Would you say that's that's true?
Absolutely. And there's been some great studies, mostly out of Europe, showing general fitness will decrease your chance of cancer. General diet. It's funny, as you probably know, everything follows the cardiac diet, and we have some pioneers in the community on that, but now the cancer diet follows the cardiac diet, and so what's a good cardiac diet is a good prevent cancer diet.
So let's talk a little bit about some of the Vermont facts, about how many cases are diagnosed in Vermont?
Yeah, there's about, I can't think of the total number right now.
This says 500 prostate cancer cases are diagnosed among men in Vermont?
For our 660,000 people, that's about right. And it's by difference, there's nothing that comes closer to the number of prostate cancer patients. Fortunately, about 2/3 of them are found at an early stage, even today, but 1/3 are not. So that's that part we have to influence.
So there are two different tests. There's the blood test, but then there's also another test?
A checkup. So basically, the blood test is a prostate-specific antigen. It's a protein in the blood. It's not very sensitive, so it's a true screening where it says, okay, we got to look at this. A physical exam is when a provider would actually, with a gloved hand, examine the prostate for lumps and bumps. Again, helpful but not perfect. So that's where we go to our secondary tests, the secondary blood tests, and the fact of following the blood test over time, which is valuable, which doesn't sound like much, but it's only the last 5-10 years that we've done that, as opposed to random testing.
Do you recommend that all men start just asking their physicians and getting the PSA test? Yeah,
if they're between 50 and 75 in good health, they should absolutely. That's the recommendations wherever you are. The tricky part is knowing your risk and being prepared at age 40. The majority of men at age 40, even with like a breast cancer gene risk factor, will have a great test at 40 and not have to do anything till 50. But the trick is learning about that and getting that first test.
And once again, this is not something where if you have a positive test, that necessarily means you need surgery or something drastic.
Absolutely. It's like two problems. One is, do I have an issue? And then what is it? Because again, the majority of people that have a cancer, it's of a type that can be very well controlled by watching it like a hawk, and might have to not have treatment for decades. And if you do have treatment, there's a number of very minimally invasive, high-frequency ultrasound, very limited low-dose radiation therapies that do great, that actually offer cure, not just control.
And so is this something that you've seen a lot of changes in over the years? I mean, I guess a lot of cancers, there's ongoing research that prompts changes in what people do to follow up on this with their doctors? Yeah,
and I came in at a very unusual time. When I started, it was right before the blood test. So the only cancers we found were advanced. And 80% of men would succumb to prostate cancer. And that was a sad time. And then we went too far the other way, finding men with mild cancers and perhaps over-treating. And now we have a nice balance that we know some of the genetic risk. They're making great strides. For the first time, you have immunotherapy for prostate cancer, where you treat the immune system, and there's very little side effects, and cancer can go into remission for years. So it's a whole new line of therapy that we didn't know would be out there, that's only a couple of years old for prostate, but in 2 years, many men have already had the advantage. So someday, even with better technology and milder surgery and radiation, we might even be able to get away from some of that.
Wow, that's amazing. And so do you think that men in general are good about talking to their physicians?
I think men we're all not great about that, but I see more of it. I see more men. You talk about what's different in 10 years, is men are now more proactive. I think we took away some of the fears of what ifs, and they're more proactive, realizing that sometimes just knowing that you don't have a lot of risk makes you feel really good in life instead of the unknown.
Well, one of the ways that Vermonters can get more information about prostate cancer is the UVM Cancer Center's upcoming Men's Health and Cancer Conference. What's that all about?
Yeah, we're very excited. The Women's Health Program is one of the best in the nation and the world, which is in October. And we were fortunate to start a men's health program. And it's everything from nutrition, exercise, to the what ifs. And also a lot of small groups, so people can come come and say, okay, what is this, this gene thing? And a lot of the men and their families have given us a lot of positive feedback that it takes some of the fear away. So we're looking forward to year 2, June 24th, and we have some international and local speakers.
Terrific. And you mentioned support groups and the importance of family being involved as well.
Oh, very much so. We're fortunate here. We have prostate cancer support groups in every community that are run by the people, for the people, and through the Cancer Center. And actually, we have 6 hospitals. Actually, every hospital in Vermont has a wonderful cancer committee now. So you can get information wherever you are in Vermont.
Well, terrific. Well, thank you so much for coming in and talking to us today.
Thank you.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.